I was having physical symptoms. I was told that there's nothing they can do in endometriosis perspective, so they referred me on to a gastroenterologist. And when I went into the doctor's room, the first thing she said was, there are some pains you have to learn to live with. As a 21, 22-year-old person, when you hear something like that, your whole world comes crashing down because I've not finished uni. I can't function. I'm losing friendships. My mental health is deteriorating because I'm in just constant pain. I can't get up and go to the toilet on my own. I need somebody to help me with things. So it was just a lot of things that were happening at the same time. I went into this phase where nobody was believing me. Nobody was ready to believe that I was in pain. I was told it's all in your head. For a few years, I just locked myself in the room. I stopped talking to people. I was self-harming. I thought of ending my life. My GP, he referred me back onto a gynecologist. He said that I think your symptoms are getting bad. The gynecologist, bless him, for the first time I felt heard. For the first time I felt like this man is really, really listening to me. And he was like, let's perform a diagnostic surgery to see what has happened, where has it spread. Later, he looked through the notes and he told me that there was widespread endometriosis.
Welcome to the 51%, the podcast where we cut through the noise and get back to basics when it comes to women's health. Through expert insights and powerful personal stories, we help you tune in to what really matters. Your body, your well-being, your life. No one-size-fits-all advice. Just real conversations to help you understand your health on your own terms. But before we dive in, I have a quick favor to ask. Please hit subscribe and join the 51% community on our website. It's free and it helps us grow, reach more women and create events that really speak to the health and wealth challenges we all face. And finally, just so you know, everything shared on this podcast is for information only. It's not medical or financial advice, and always speak to a qualified expert for support. Sana, welcome to the podcast. It's great to have you on. Could you talk a little bit about your journey? I know there are multiple things that we're going to be talking about here. Your journey with endometriosis, fibromyalgia, and also osteoarthritis. There's a lot to unpack here, and it's not just about the journey. There are other things we're going to delve into. So please introduce yourself. That's great. Thank you so much.
Thank you for having me here. I'm Sana Kardar. I graduated as a biomedical science student, then went into bioscience futures, which was like more into entrepreneurship. And the reason why I pivoted from a research-related role into more entrepreneur role was because of my condition. I could not spend long hours in the lab. And then I thought, I am privileged to be here and can be the voice of so many women. So why not use this as a transitional journey and, translational science as well, from lab to the real world. So I was somebody who was extremely athletic. I used to play squash for Pakistan, nationally, internationally. And when my father passed away in 2014, I went into this dark abyss of depression where there was no way coming out because it hit me so hard. It was quite sudden. And after that, things started to go downhill. My partner noticed that first my mental health was deteriorating. And then I was having physical symptoms, including pains, which never existed before. Or maybe they did and I never noticed, but now they were too intense. To a point where one day I was crossing the road and my leg locked, the groin area, the joint just locked in the middle of the road. I called up my GP and she said that you need to go to A&E now. So somehow managed to get to A&E. Before that, my GP did suspect that I may have had endometriosis because of the pain and offered me a surgery. But as early 20s, late teens, I was afraid to have a surgery that early on. So I said, I'll go on the pill, which did not help at all. Continuously bleeding and bleeding got much worse. Eventually, I did have to go for a surgery because of that lock that happened, because they thought there was a cyst. And if that ruptures, it could be fatal. They did not send me home, kept me in the hospital for about 2 days, trying to see what's going to happen. Eventually, I had my surgery in October 2016, where they said that they have removed all the endometriosis. And because I was too young, I felt that, this is it. It's sorted. The cyst has been removed and I can just carry on with my life. But that wasn't the end of it. That was actually the beginning of a very, very long journey, the journey that I'm still walking. I was told that there's nothing they can do in endometriosis perspective. So they referred me on to a gastroenterologist because the pain was still there. They thought it was that. And when I went into the doctor's room, the first thing she said was, there are some pains you have to learn to live with. And as a 21, 22-year-old person, when you hear something like that, your whole world comes crashing down because I've not finished uni. I'm still in uni. I can't function. I'm losing friendships because I'm not meeting up and keeping up with the plan. My mental health is deteriorating because I'm in just constant pain. I can't get up and go to the toilet on my own. I need somebody to help me with things. I can't sleep through the night. So it was just a lot of things that were happening at the same time. My body was changing from a lean, athletic body. I was suddenly bloating, looking like I was 9 months pregnant. And that was all because of the side effects of medication I was on. And I went into this phase where nobody was believing me. There was a lot of medical misogyny and gaslighting. Nobody was ready to believe that I was in pain. I was told it's all in your head. And I just dropped out of uni as well. I was like, I can't go back to uni because I couldn't cope up. I knew there was support available, but I did not have the energy to fight it. And for a few years, I just locked myself in the room. I stopped talking to people. I was self-harming, thought of ending my life. And I tried a few times as well, just that either my partner reached on time or there was time when he wasn't there. He had to call the ambulance. Ambulance could not get in. The police had to come in and make sure that I was safe until somebody arrived. And it was very, very regular. Like I was just terribly in a bad place where I just didn't want to continue anymore. And I had considered assisted dying, going to Switzerland or something.
Yeah.
And in 2020, finally, I had a new GP because my previous GP had moved to a different role. And that's why the whole issue started, where nobody was believing me. When I needed a sick note, one of the GPs at the practice said, why do you need a sick note? People with endometriosis live normal lives. Like, okay.
Yeah, I don't really know many people with endometriosis that live a normal life, and what exactly is a normal life.
And all I needed was a sick note because I could not complete one of my assignments on time, and they just needed for mitigation. And that was one of the things that was like, I can't keep fighting this. I'm just going to give up.
Yeah.
So in 2019, my GP, who's still my GP, and I hope he doesn't leave the practice, he referred me back onto a gynecologist. He said that I think your symptoms are getting bad. We are going to refer you back. The gynecologist, bless him, for the first time I felt heard. For the first time I felt like this man is really, really listening to me. And he was like, let's perform a diagnostic surgery to see what has happened, where has it spread. Because previously in my 2016 surgery, I was not told what did they do. There were no surgery notes. Discharge was like, we removed endometriosis, performed ablation, and that's it. That's all I knew was done. Later, he looked through the notes and he told me that there was widespread endometriosis in 2016 surgery as well, where my ureters were stuck to my pelvic wall. They had to shave that off. My organs were entangled, so they had to, untangle them. So they decided to perform another surgery. My surgery was scheduled for the day we went into lockdown in 2020. So it got postponed for indefinite period. I did not know when I was going to have a surgery again. So I took onto social media and was ranting about how women's health and is dismissed. And at that point, I did not know how massive COVID is going to be. But it was just me being really, really upset that after years of fighting, it was like 5 years of fighting, and I finally got a date. And then that has been postponed as well. That post went viral everywhere. My inbox was flooded with messages from women from all over the world saying they felt that they had written the post. I did not expect that.
Yeah. Was it a reel you did, or was it just a...
Just like, it had some pictures of my first surgery after recovery, and then it was a post for Menstrual Hygiene Day. And I think for the first time I had openly spoken about endometriosis and what it is and what it feels like to live with something like that. And by then I think I had done a bit more research to understand what the condition was, because before that I was just like, okay, it's endometriosis. I thought it was just a cyst, nothing more. And when these women got in touch with me saying that this is what it is, their doctors have said the similar things, they felt like they have written the post, I felt like I should do something about it. I have the privilege. There are a lot of women from South Asian community especially who cannot openly talk about their issues. Because women's health, anything related to period, reproductive, sexual health is still a massive, massive taboo. And if I can be the voice, I would be the voice for them. Then one day somebody called me and said, if you don't answer my phone, I'm going to kill myself. And I was like, okay.
Oh, gosh.
And that was really scary.
Yeah.
Because I don't, answer unknown numbers.
Yeah.
It was on Messenger, on Facebook Messenger. And I was like, okay, let me answer and see what's happening. And it was a young girl, probably just fresh out of medical school. And she said she has endometriosis and she's seen my post. And she's afraid to tell her bosses about endometriosis because she feels like she will be discriminated. She does not want to have a surgery. Even if she wants to, she can't because she's in Pakistan. She can't have any treatment related to endometriosis because of the taboo attached to the whole situation.
She was from a different country.
Yeah, she was from Pakistan.
Yeah. Okay.
And in Pakistan and they have the concept of hymen and virgin, and you can't do internal examination, you can't do any kind of so even she could not have internal TVS, transvaginal ultrasound. It was all had to be done externally. She couldn't do it, and she was a medical doctor herself.
Wow.
And she was like, I'm taking injections for pain. I'm like, that's not right. You shouldn't be taking that many injections every time. And that made me realize that something needs to be done, especially for South Asian women, because around the same time, a lot of BBC and ITV reports and news were coming out on endometriosis as well. But you never see a representation from South Asian communities. But you never see representation from brown people or any other ethnic minority. And that's wrong because everything, cultural aspects, societal aspects are different in different ethnicities. And also how certain medication and treatments work on certain communities is also different. What may work on a Caucasian female might not work on people from South Asia. So I created a Facebook group, which was initially endometriosis support group. It has 10,000 members now. We don't give medical advice. We support people. We signpost them. We refer them on. We ask them. We tell them how to ask the right questions. We listen to them. We don't judge them. We don't ridicule them. Whatever it is. Which initially started off as a endometriosis group is now a women's health group, because there are a lot of other conditions that are kind of linked to endometriosis, whether it's PCOS, fibroids, infertility, mental health. And as you mentioned earlier, I have a list of other associated conditions: fibromyalgia, osteoarthritis, hypermobility pain syndrome, POTS, and the list goes on. And it is quite hard to manage. And I think, and these are all invisible conditions. You don't see a light popping somewhere that, okay, this part is in pain right now. And that's why a lot of people do get ridiculed. So that group has now 10,000 plus members where they support each other. They're members from all over the world. We have a list of non-judgmental doctors who would listen to them, who would believe them without questioning or telling them it's all in your head. So that's my journey in terms of endometriosis and other conditions. It's been quite a hard one.
I have so much respect for you with everything that you're doing. It's almost like, you went from a very, very dark place and you've come out at the other end. It's almost like you found your tribe. When you put that post out, people resonated and people felt heard and seen just from that one post that you did. And it's almost like you found your tribe as well to help you through all of that as well, which is absolutely fantastic. And all the work you're doing now is absolutely amazing. I'm sure there are a lot of women, especially from the South Asian community. And again, thank you so much for sharing so much detail, because there are so many taboos in the South Asian community that don't get discussed, especially some of the things that you've talked about. So you were born and raised in Pakistan.
Yes.
I want to ask, did you start experiencing symptoms then as a teenager, or was it when you came back? At what age do you think you started feeling symptoms linked to your menstrual cycle perhaps, or any pain that you were experiencing that you perhaps thought this is just normal part of having a period, as an example?
So I moved to the UK when I was 15, and just a few years before that, I started having my menstrual cycles. When I look back now, I see that these are the symptoms other people have reported as well. Growing up, I used to have a lot of leg pain, and it was always dismissed under, oh, these are growing pains, or you've played too much, you were running around, and maybe that's why you're tired. So they started quite young. I used to be somebody who was active, but not hyperactive like my sister, who was only 11 months younger than me. She could run around the whole day, hide and all that. But I would manage my energy. And I was one of those, maybe because I'm the eldest daughter in a South Asian family, sitting and reading a book would be more my thing, listening to music, or instead of just running around and mischievous.
Yeah. I mean, you were a squash champion as well, right? So...
Yes, that came when I was about 10 years old. And that was also because my sister was playing squash and I was kind of pushed into it because, go along with her.
Yeah.
Yeah, she's
That's
traveling. So,
usually the case, yeah.
But I did become good at it and better at it than her, that's another story. But so I had symptoms where my joints were extremely weak. I would keep on twisting my ankle. I used to play football as well, and I lost my ACL while playing football. I had repeated surgeries on that as well. But it's a gone case now. And once I started my periods, which was kind of like at the age of 12, 13, they were very heavy periods and long. I would have heavy bleeding from day 1 to day 8.
Wow, okay.
And sometimes, especially when I was playing squash, I'd have to either wear like double layers of the sanitary napkins because I wouldn't want it to leak while I'm out playing. And there were times when, because I'm playing, I would bleed more. The first days were extremely, extremely painful, but because we were playing squash, we couldn't make any excuses. And I know I had friends in school who would not even move from their chairs when they would be on their first day or second day of period, while I had to go and do things. And because in squash, you have to be very disciplined. One day of missing the training, you'd miss out a lot. Your muscles will start to break and then you'll have to break them up, make them up again, and then cramping will start. So that's why I'd rather have a little bit of training every day. And especially if there were any tournaments, we can't decide the dates. Even today, I think my endometriosis is very different to a lot of other people. I'm sure there would be a lot of people in the similar boat as me, where my periods are the happiest days of my cycle. After my ovulation to my period, that's the worst period. So I used to have these symptoms. I used to have pains, but I think they were all dismissed, thinking it's just period pain, or it's just because I've been working out or I've been training hard and it's just that pain. And because we used to work out regularly and train, we would go to sleep. We'd have a long, full 8 hours sleep. But I've realized that even today, if I'm not exhausted to the right level of exhaustion, I can't sleep.
Right.
If I'm little overexhausted, again, I can't sleep. So it needs to be the optimum level. Other than that, I don't think I had any other symptoms.
So would you say you almost like you dismissed your own symptoms?
Yeah.
Because you just thought it was, I guess the narrative is generally, if you have a period, you're going to have pain.
Yeah.
Periods are linked to pain of some sort. You don't know whether the extremity of that. And if it is extreme, it's usually the narrative is take a paracetamol for your cramps.
Yes.
And if that's the narrative, you're just going to dismiss that then anyway, right?
Yes. And what I've learned over the years is that pain is not normal. There was this one time I went to a doctor, and they were like, what is your pain level? And I'm like, the normal level. They're like, pain is not normal.
Yeah.
There's no normal level of pain.
Yeah.
So that's when I realized that I've been dismissing it. Maybe if I had brought it up earlier that I can't function, the pain is really bad.
Yeah.
Because I'm expected to do certain things, I push myself through it, and that was wrong. So I do think I had endometriosis for a very long time, maybe before puberty as well, because it has been found in fetuses as well.
Yeah.
But it's just that it was my dad's death that kind of triggered everything.
How old were you when that happened?
I was 19, 20.
So that would have been when you were in the UK then?
Yes.
Yeah. Yeah. So would you say, because I know you found to have fibromyalgia as well, and again, I've heard of lots of stories where that gets dismissed because it's a type of pain, but no one can see anything. And it's almost like you're going round and round in circles trying to figure out what's wrong, and then perhaps even told to take ibuprofen or something like that to reduce your pain. Yeah. Can you talk through that? Is that something that happened after your father passed away? Was that a trigger, or was it kind of part of the whole endometriosis? Are they what I'm trying to get at, are these things all separate, or are they connected in some way?
They're kind of connected because endometriosis is not a gynecological condition. It's a systemic condition. It can spread anywhere. The only thing is that the tissue mimics the lining of uterus. It has very similar biology to cancer. It spreads the same way as cancer, and it reacts the same way. It produces its own hormones. it starts generating its own nerves and its own blood vessels. So it has its own network that makes it really difficult. And the inflammation comes from the fact that when the brain sends signal to the uterus to start bleeding, the same signal goes to all the other deposits, and they start bleeding as well. But there is no outlet. Like, for example, when lung endometriosis that I have, I've had a recent surgery for that. The only way it can come out is through my nose or my throat. But sometimes, and the one on diaphragm cannot come out from anywhere.
Yeah.
So it's just there, and it causes a lot of pain, and then it forms adhesions later. I don't think I had fibromyalgia before endometriosis. I may have had hypermobility because, I used to be very stretchy and flexible. But apparently a lot of South Asian people are like
That's
that.
right. Yeah.
But the problem is it has become a syndrome. It has become a pain syndrome now. So again, for fibromyalgia, I had to kind of fight to get it recognized. I was under a pain management clinic. They were looking for hypermobility pain syndrome, EDS, and other things. Like, it was a group management. And there was a psychologist, pain psychologist and physiotherapist. And they said they think that I have fibromyalgia. They referred me on to the rheumatologist. When my GP tried to do that previously, I was dismissed because rheumatologists don't deal with it. And GPs do not have the capacity or the training to diagnose somebody with fibromyalgia. When I got referred on to this person, he said, "Oh, if you just want a tag or title, I can give it to you." Like, it's not that. It's about recognizing that I have this condition and how do I manage it.
Exactly.
It may be very similar to how I manage my hypermobility, but at least when I'm going to a workplace setting, when I'm going to a university, college, I can tell them this is what I have, and then they can provide me reasonable adjustments. So it's not just a tag I want. It's my body, and I need to identify what is it. And I can't take every sort of medication for everything. I need to understand. So that's when I got diagnosed, I think, in 2022, fibromyalgia. But I think it was way before that as well, because I have terrible pain everywhere, and like sometimes just the touch of the cloth on my body hurts me. The people who love to hug, right, and I tell them that don't, or sometimes when you're shaking hands, especially men, would just like
tight
crush
grip.
Crush your bones or something. Like, please don't do that. I have really tight, soft bones, and I can literally feel them being crushed. So it's very hard for me to explain to people that the reason why I don't want to hug somebody, especially when I'm going through a flare-up, is because my body is going to react.
Yeah.
And with hypermobility and fibromyalgia, there's another thing that comes with, maybe a lot of people do not know, that you can actually get rashes on your skin. Like, for example, if I were to shake hands with somebody or just randomly, I could just get my entire arm can go red from a rash. So it's not because somebody's not hygienic or whatever, but it's how my skin is reacting, because I have oversensitive skin. Again, it's very difficult to explain to people. I was referred on to neurology, neurosurgery, and I was dismissed there as well. There was this man who kept on telling me how young and beautiful I was to have all these conditions, and I should actually go and cook food instead of going to hospitals. And then he kept on, and I felt like it was very, very racist when he said, "Oh, I can tell you in Southall where to buy your spices." And my partner was sitting right next to me, and I just felt like I wanted to punch him. And it was a doctor, it was a neurosurgeon. Yeah. And he kept on telling me, and he did not listen to me.
I'm assuming he wasn't South Asian, was he?
He was.
He was.
I don't know whether he was from South Asia or one of those immigrants to another country who moved here.
Yeah.
Ethnicity-wise, he was South Asian from the name. And I felt like it's really, really sad that I have waited nearly 2 years for this appointment. I've come here to understand what is going on, and all I hear is buy spices and Southall. I mean, I don't cook. I don't like cooking. And one of the reasons I don't like cooking is that when I was going through that phase, I wanted to stab myself. So I don't feel safe in the kitchen. If I feel like I need to cook something as well, my partner is there with me to make sure I'm safe. And constantly gaslighting me into like, "Oh, you should learn to cook. You should definitely cook." And that's not why I'm here. If I want to learn to cook, I'll go to a cooking class.
I'm really shocked. I mean, I've heard stories of people saying things, but this is on a next level. I just can't believe it. It's absolutely ridiculous. And I almost feel like calling these people out and kind of naming and shaming, to be honest.
Yes. If I were to write complaints about people who have either been very misogynist or have gaslit me over the last 12 years, I think I'd have a book of 1,000 pages or so.
Wow.
I literally had to prove myself at every single step that I'm not lying. I had an endometriosis specialist once who told me I don't have endometriosis after I've had 2 surgeries confirming I had endometriosis. And he said, I don't think so.
How's that so?
So I said, do you think your colleagues are lying? So should I sue them? Because obviously somebody's lying. Either you are lying or your colleagues are lying.
Yeah.
Evidence, there are images that clearly said that I had endometriosis. And he just wasn't willing to refer me on, or it was not under his capacity to do anything. Eventually, I was pushed to have this particular injection, which was the worst mistake of my life. He was like, you take this, otherwise I'm going to discharge you, which is a GnRH. It is called Zolodex. And it's usually given to men with prostate cancer and women with breast cancer. It is licensed, but it's not something that you should take for more than 6 months in your entire life because it reduces bone mineral density, and it messed me up badly. It messed up my mental health. And the thing is, 1/3 of women are resistant to progestin, according to a paper by Nuffield College and University of Oxford. But a lot of doctors don't take that into consideration when they are trying to shove medication on women. So I took that injection for 4 months, and eventually he referred me on to a BSGE center, which is the Endometriosis Specialist Center, while believing I did not have endometriosis. And when they performed the surgery, they said everything was like this, entangled. My bowel was stuck to my uterus, to my fallopian tube, my ovary were all stuck together, my ureters were all messed up, and they had to remove some uterosacral ligaments as well, the ligaments that hold the reproductive system together in the abdomen. So I really did not understand what he meant by that I did not have endometriosis when a surgery, which was less than 6 months later, confirmed I had such terrible endometriosis.
So you said you had this injection as well, right? Do you think that's linked to the osteoarthritis?
Probably, because my bone mineral density reduced significantly after that. Now I can't sleep on my sides. I can't carry anything heavy. Sometimes, in the winter you have heavy coats. I can't wear any heavy coats because the weight on my shoulders, I just feel extremely painful, like somebody's hammering my bones. So if I were to choose between the lesser of two devils, I would take endometriosis pain over bone pain, because the bone pain that I suffer right now is way worse than endometriosis pain. And that is because of that injection. And following that injection, I was given another tablet, Dismissal, which works for a lot of people. But again, if I'm resistant, it's not going to work for me. And I do think I'm resistant because every medication that has been given to me did not work because it had progesterones. So that medication is licensed to be given at 2 mg. But because I still bled through it, I was given 4 mg. So I was given twice the dose that is approved by NICE. So again, that caused a lot more. So if you look at the leaflets of all the oral contraceptive medication, bone mineral density is one of the side effects, losing bone mineral density.
That is a lot. And, you talk about the mental health side of things as well, And again, if I'd met you for the first time and I'd never known any of this, I would not have known that you have something wrong. So this is, again, we talk about invisible disabilities, invisible illnesses. So no one would know looking at you on the outset that these things are going on. And then you've got the whole mental health side of things that underpin a lot of this as well. That is a result of everything that you've been through with your health conditions, and then obviously the grief, and all of this has caused serious mental health issues, which is something, again, that the South Asian community do not discuss at all. Can we just address that a bit? Because I think this is a really important aspect of anyone really going through anything, whether it is a health condition or anything that they're going through in life. No one really talks about the mental health side of things.
Yeah. So I felt like until my dad was around, I never felt I had any issues, no anxiety, nothing. Even if I'd failed an exam, well, I haven't failed an exam, but even if I'd scored low, I never had the kind of anxiety that I have now, where I constantly live through anxiety, where I feel like something is going to go wrong, and you don't know what it is. So I think the first time as I mentioned earlier, that my partner noticed that things were not right.
Your partner, it seems like you've been with him for a very long time, and he's gone through this whole thing with you as well, right?
Yes, he has. Luckily, he's a medical doctor, so he sees things.
Okay.
He sees things before probably I
Of
noticed.
course.
But he has been a very, very strong support and pillar. So he noticed when my dad passed away how my mental health was deteriorating. And I grew up in a Muslim household. And I really do not understand why in Muslim households, well, it was not my family, but my extended family of friends who dismissed my mental health. I had a childhood friend, one of my friends from day one of school. She is a medical doctor practicing in Germany as a psychiatrist. And I thought I was on the NHS waiting list. So I thought until I get to them, I'd speak to her, just try to understand what can I do to help my situation. And the first thing she said was, you don't just develop depression in a day. Why don't you just read some Quran? And I felt so dismissed at that point.
Oh my God.
I don't think so. I developed it within a day.
Yeah.
I think it was there. Maybe this may not be depression. Maybe it's something grief. And this was not soon after my dad's demise. It was like a couple of years later. And I had been diagnosed with endometriosis by then as well. So a lot was happening.
Yeah.
A lot of uncertainty. And when she said that, read some Quran, I just felt like it may work for some people. It may not work for everyone. I used to get anxiety reading Quran. I have my reasons why. And it was quite hard for me to just forget about everything and start reading Quran. It didn't help me. And then started my journey with mental health, trying to make people believe that I really, really need support and there should be some sort of connection or some sort of mental health support for people with endometriosis or chronic invisible diseases.
What about your family? How did that transpire? Because often, even families dismiss. Was there support within the family, your siblings, your mum, extended family, or was it kind of not talked about or, again, a taboo subject within the family as well?
So my father, again, was somebody who spoke very openly about mental health. My sister at one point was stuck where she was the greatest player of the team, but with one player she'd always lose. So my dad would take her to sports psychiatrists to understand what were the blocks.
Yeah.
And my dad did psychiatry as well. So mental health was something that was considered very important in our family. But once he passed away, I think we were all grieving in our own way because it was sudden. It was not expected. And my partner, he is a Hindu, and Muslim women cannot marry or be with Hindus.
Yeah.
They can still be with people from the book, but not with somebody from that religion. So that's where my mom and I had a bit of issue after my dad passed away. So that also impacted my mental health because I couldn't talk to my mom. My brother and my sister, the youngest sister, were my support system.
Yeah.
They would talk to me. They would make sure that I was fine, checking in with me. My mom came around eventually in 2019 when my partner had a terrible accident, and she realized that things that I was doing for him, I'd completely forgotten I had my own issues to deal with.
Yeah.
But the way I was looking after him is when my mom realized that, you know what, I'm not going to change. And she accepted him, and now they're on quite good terms. And they talk more than they talk to me. They gossip partners.
Yeah.
So when after that, mental health support from mom and siblings was there. It was just that short period where I think we didn't know how to grieve. And so we were just taking our own time. Other than that, the mental health support from it just had been terrible. I've been put on waiting lists time after time. I was seeing somebody and then they suddenly disappeared. They were like, oh, we'll have 2 more sessions. And after that, I'm moving into a different role, but somebody else will take over. And the next time I went there, they said, this is the last session. So I had prepared myself for another 2 sessions with this person. And then they just suddenly disappeared. And nobody took over from there. And since then, I've been fighting. And I was at a really, really bad place in my life at that point where I was living through anxiety every single day. Like I felt like my heart would jump out of my throat. I have PTSD as well because in Pakistan, I've actually witnessed a bomb blast outside my school.
Oh, okay.
So I think around that time, there was the London Bridge attack that happened.
Right,
so that triggered me quite badly. So there've been things that have been interlinked, and mental health is still terrible, but I'm managing it somehow because I know I can't keep fighting on all fronts all the time. One of the main aspects of mental health that really, really bothers me now is how my body looks. I'm very body positive person, but being a size 8 in the morning and being a size 14 in the afternoon is something that affects me. Or you wear something and it doesn't look good because your body decides not to behave that day. Yeah. And whatever you do, you can't do anything. So that affects, because I don't know what to wear. I don't know how to look good. It's not that, oh, I want to be size 6 or size 10 or whatever it is. I just want to be one size so I know what to buy, because I'm spending so much money on my clothes.
Is that because your body's reacted to different things? Are you talking about things like bloating and feeling really bloated?
Yeah, and water retention.
Yeah. So that's like literally your whole body then. Bloating, I know, like I experience bloating like crazy. And then one minute, you know, even my kids come to me sometimes and like, Mum, you look like you're 9 months pregnant.
Yeah.
Like literally. Yeah. And I cannot get into my trousers or jeans. I mean, there's all sorts of things that can be going on. And you're right, it is difficult to, you know, you buy a pair of jeans in a certain size and then the next minute, the next day or in a few hours, you can't get into them.
So I make a lot of trips back to the shop and I can't fit into it anymore. Yeah. And it's kind of annoying as well, because you envisage yourself in a certain attire and you're like, oh, yes, this is what I'm going to wear. And then on the day, it doesn't work out. Yeah. I was mentioning earlier that, you know, recently I went to Malaysia and I've realized I went in 2022 as well. And when I bought clothes from here, which kind of fit, and when I got there, they wouldn't fit. So this time I realized I have heat edema. So this is something new, which I figured out that my body kind of buffs up, or there's more water retention because of heat, which I don't have here probably, but yeah. Yeah.
Do you feel like you're being treated for different conditions separately, and also there must be some kind of link between the three somewhere, and there's something missing in this treatment? You're not looked at as a whole. You're looked at you're cut up into different pieces and just looked at that. Let's try and fix that thing. And then that thing's fixed. But then there's also this other thing going on. You're not treated as a whole person almost.
Yes. So this is something I raised a lot of times with a lot of people, that one medication you might be giving me for one particular thing is causing side effect to another thing and flaring it up. So we need to look at it as a whole. I had my ACL surgery soon after my endometriosis surgery in 2020. We're like, oh, you're progressing so slow, because I had an endometriosis surgery and, you know, I'm a whole person. My leg is not functioning separately to the rest of my body. Yeah. And it's quite hard for me to explain to people that you need to treat me as a whole, because here departments don't communicate with each other as well. So last year I had 2 surgeries. One was for my pelvic endometriosis and another one was for my thoracic endometriosis. After pelvic endometriosis, there was a scare that I may have abscess. So they sent me for a day surgery again to see if it was really an abscess or not, which later was ruled out. But they found out a cyst on my ovary a month after my surgery, which was probably endometriosis cyst. And the surgery unit had requested for a scan another 8 weeks later to see whether the cyst was still there. But nothing was communicated to my gynecology team. After like 3 months of waiting, I had to contact them that what's happening. They were like, oh, we don't even know. So yes, nobody treats the body as a whole. It's treated as if your mental health is separate. They don't consider everything else. I was told that, oh, if you start going back to work, back to university, you'll feel okay. No, I still have to fight a lot of people at the college, at the workplace for reasonable adjustments. I have to advocate for myself. Same thing with fibromyalgia. I feel like different doctors try to blame the other department. This is because of that, so you should go and talk to them. This is because of them, so you should go and talk to them. I feel like if it's endometriosis doctors, they say it's because of everything else that's happening in my life. And if it's anyone else, they say it's because of endometriosis. So I'm just stuck between the devil and the deep blue sea, running from pillar to post.
Yeah. And then when you're doing that, it takes 10 times longer, because waiting lists for each area is however long it is. So once you wait for that thing, then you're on another waiting list for something else, and then you're just waiting and waiting forever and ever. As you're waiting, things progress and things get worse as well. And then at the same time, your mental health is getting worse as well on top of that.
Yeah, so like I had a lot of hospital appointments in January and February, but because I had my thoracic surgery in December, I could not attend those. To have them rescheduled, it was a nightmare. They're like, oh, you have cancelled it, so we are going to discharge you. And I'm like, I'm not cancelling it. I'm requesting for another appointment, because you should have seen my notes that I have had a surgery and I cannot come in because I'm supposed to be recovering at home. So again, miscommunication between and it's the same trust. It's not even different trusts where you can say that, okay, one trust did not communicate with the other trust. So yeah, so it's very hard for people like me who have multiple chronic health conditions to deal with things when departments don't communicate, where people don't treat you as a whole.
All these different things that you've gone through and dealing with so many different doctors and specialists, what would you say to anyone in terms of advocating for their health? And also, can you talk a bit about the advocacy work that you do? Because I know there's so much of that you're doing as well.
Yes. So I would say that when somebody's going for a hospital appointment, whether it's a GP or a specialist, because we have very limited time, prioritize what you want to talk about. Because if you start talking about everything and it's all over the shop, they would not understand what you want from them. So be very specific what exactly you want them to have, what you want them to do. Yes, sometimes it is important to tell about what is in the background as well for them to understand. But, your top priority should be 1 or 2 or maximum 3 issues that you talk about. I also feel like a lot of times doctors just say, we can't do this, because they just say it. I've worked in NHS as well, so I know how things work. They have targets. And in the end, it's the patients who suffer. As I mentioned earlier, my friend who was a doctor, she knew what being a doctor is like. Long hours, less pay, dealing with patients all the time. You can't blame it on patients. You chose that career. Nobody forced you to do it. So you need to show some good bedside manners. So if you're refused a treatment, ask them to put it in writing. The reason why is it being refused, and so that it goes on your file. And if you need to take up against them at any point, you can, because it's in writing. I've asked several times that, I want this particular test done. And I've been told, oh, you can't do this. And I've asked them to put it in writing, and then they have actually offered the test. Because if it's in writing, then they need to explain. And if anything goes wrong in future, then you have that covered, that you requested for it. And I would also say that learn about your condition, whatever the condition is, educate yourself. Don't Google it, read papers. And if you're reading scientific papers as well, do look at conflict of interest before reading the paper, because that kind of would say that who's funding the research. Like if GSK is funding a certain research, then it would be in their favor.
Yeah, of course.
So do read that statement before you read any paper, and try to understand what the condition is. These days, there's a lot of misinformation out there on social media. Everyone is a doctor, an influencer. And again, influencers get paid to promote certain things. So just because they're promoting certain things doesn't mean that it's right for you. Different bodies react to different things differently. Listen to your body. Your body knows what it wants and what it should be doing and what you should be doing. So just because somebody is selling something on social media, do not follow it blindly. Look it up, research on it, whether it's good or not. Speak to a medical professional as well, whether it's good or not. Because I asked one of my gynecologists about these GLP-1, not because I wanted to lose weight, but because I was reading up a lot that in the US, a lot of women who have endometriosis and diabetes were given GLP-1, and the endometriosis symptoms had significantly reduced, because apparently the new research, again, I haven't done a lot of research on it, but it's kind of related to insulin resistance as well, and it reduces inflammation. So it may be helpful. So I asked my gynecologist, and she said, you can try it for 3-4 months and see if it works. If it doesn't, then, because there's very limited research right now. So again, if something works for you, great, but speak to a medical professional first. And in terms of my advocacy, I share my journey on my Instagram blog. Again, if I find time, I do that. I try to do as much as I can. I have that group on Facebook where I have women from all over the world who share their journeys, who support each other. I work for an MP now, and during March, which is Endometriosis Awareness Month, I kind of pushed him to ask a question at the parliament regarding endometriosis, because an endometriosis report came out that the waiting times on diagnosis have gone up instead of going down. And we met at one of the talks.
We did.
For hidden disabilities, and my MP was there to support me. He has been doing quite a lot of work on health strategy and women's health. So I think that is somewhere where advocacy has worked out for me. And I continue to speak about it very openly, even though people have told me, oh, you are always ranting or you're just talking negative. I'm like, but I made a difference where in my social circle, at least, if someone hears the word endometriosis, reads anything related to endometriosis, the first thing they do is send it to me. So I know that if they can see that the things that I have gone through, and if they hear the word endometriosis and somebody else says they have endometriosis, I'm sure they will be a bit more compassionate towards that person.
Yeah.
So I think even if I change the life of one person is something valuable for me. And I feel like if I am making a difference, even if I don't feel the change, at least the generations to come will, and they may not have to fight as much as I had to or people before me. So I always believe this, that the journey of 1,000 miles begin with a single step. I think that's really important for me.
Yeah, absolutely. Question, how are you now?
It's still very unpredictable. I have good days and I have bad days.
Yeah.
I feel like when I want to do things, maybe my brain is getting a bit more stronger as compared to how it was. Like last night, I couldn't move. I was in so much pain. I could not go up from the living room to the bedroom.
Yeah.
It took me 15 minutes just to, I had to sit up and go up.
Yeah.
I was like, I don't know how I'm going to do this morning. I woke up, I was fine.
Yeah.
So I just take one day at a time.
Yeah.
I have learned to respect my body way more than I used to, because previously I would push myself through things. Now I've learned to say no. If I can't do it, I can't do it.
Yeah.
I will try to make arrangements, reschedule something. In terms of my social events as well, I pick and choose where and when I need to go. If I can't go, I can't go. I can't help it.
Yeah.
My health comes first, because I feel like these conditions have robbed at least 10 years of my life, where my peers have progressed more than I have to a point. I'm okay. I'm not that kind of a person where, I should have been at this level right now.
Yeah.
I'm progressing at my own pace, but I feel like, if I don't respect my body, it would not work around me.
Absolutely.
So, so now I pick and choose, and I'm very conscious of what I'm doing. I have to be very careful what I'm eating, drinking, everything.
Yeah.
So I make those informed decisions now.
Yeah. It sounds like you're more in control of things now, and you're more aware.
Yes.
And you've built a network, you've built a tribe.
Yes, and I'm also working on a startup, which is for endometriosis. It is an AI-powered tool to help therapeutics during life surgery. Okay. So it can help these surgeons so at the moment, the reason why there's a long waiting time is because we're very limited endometriosis specialists in the country, and the normal gynecologist surgeons may not be able to differentiate between an endometriosis lesion and a scar tissue because they kind of appear very similar. So they may miss those lesions. So my tool is going to help them identify whether this is a scar tissue or an endometriosis lesion while they are inside operating. So it would reduce surgery time, and we're kind of bridging the gap, the skill gap.
That is amazing.
It's in very early stages, but hopefully.
So watch this space. I can't wait. Absolutely be speaking to you again once that's all developed, for sure. Sana, thank you so much for being on the podcast and sharing your, real personal journey, and in its kind of raw format. It is really, I really appreciate that. And I really hope that someone can resonate with your journey and can lead to your Facebook group as well if they need any advice. So thank you so much.
Thank you so much for having me here. It was really interesting speaking to you about everything. And also, I'd just like to add one more thing, which I've seen in my household, and my brother is somebody who has learned over the years to support his sisters when they're menstruating. So I think it is very important to teach the sons as well that it's okay. It's nothing to be ashamed of, because whether it's mothers, sisters, wives, or whoever, girlfriends, they can support when they're going through a tough period instead of just walking away. And I do see a lot of change as compared to yesteryears.
Oh, yeah. Absolutely, yeah.
People are more aware and compassionate.
No, definitely. I think having open conversations in your household, everyone's going to be near a woman at some point. It's kind of, we're 51% of the population, right? So the more it's talked about within your household, the more it becomes normal and less taboo. And the education really has to come from schools as well, from a young age, which isn't quite there yet, in my opinion. I think there's a lot that needs to be talked about through schools, for sure.
Yeah, especially women's health conditions, I think is something that needs to be added into that sex ed part.
Absolutely.
It's important. And especially at workplaces, you need to consider it work colleagues as well when you're going through a certain flare up or
definitely
a period.
So thank you so much, Sana. Thank you.
Well, thank you.